Bonjour, je
Hello, my
m'appelle
name's
Sarah,
Sarah.
j'ai
I'm
35 ans et
35
j'ai
and I
un
have one
enfant.
child.
En général, on me
Generally,
donne moins que
people
mon
say I look
âge.
less than
Les
my
mots qui me
age,
qualifient le
but
mieux sont
those who describe me
courageuse et aimante.
best, the words that describe me
Je
best
dirais de mon
are
visage qu'il est
brave and
harmonieux, mais
kind.
qu'il manque encore quelque
My
chose.
face is
Oui, je
harmonious,
prends
but
soin
it's
de mon
lacking
apparence et j'ai
something.
des rituels beauté,
I have all the usual
masques,
rituals, the
faire
beauty
attention à mes
rituals,
mains, parce que je pense que les
masks,
mains c'est très important aussi. Et je
and
fais très attention à mon
I'm very
alimentation.
careful with what
Prendre
I
soin de
eat.
soi, c'est
Looking
quelque
after
chose de très
myself
important au
every day is
quotidien,
something that I think is very
dans le
important.
travail,
In
dans
your
la manière
work, the way you
d'interagir avec
interact
les
with
autres. Je
other
pense que ça se
people,
ressent
I think
au
it
quotidien.
shows in the way you are.
Une belle femme pour moi,
A
c'est quelqu'un
beautiful
qui a
woman for
confiance
me
en
is
elle
someone that's
et qui
has
dégage du
confidence in
charme
herself and
et qui a
charming
beaucoup de courage.
and has a lot of courage.
Aujourd'hui, ce qui me dérange sur
What
mon
disturbs
visage
me
et que
about
j'aimerais
my
améliorer,
face
ce
is,
sont
I
mes
think, it's
lèvres
my lips.
que je trouve
They're
assez fines
too
et du
thin
coup pas
and not
totalement en
totally
harmonie avec le reste de mon
harmonious with the
visage.
rest of my face.
J'attends que le résultat
So
soit
I hope the
harmonieux,
result will be harmonious
qu'il
and that
soit
it won't be
pas
too
trop
obvious,
flagrant
that
non plus,
it'll
que ça reste
stay
naturel, mais que ce
natural,
soit
but
assez
it'll be quite
sexy.
sexy.
Hi everyone, we have the wonderful Sarah with us. Sarah is 35 years of age and she would like to have her lips augmented to be a little bit fuller. She doesn't want to look too done and that's her request. Am I right there, Sarah?
Yes, of course.
Of course. She wants to look, in her words, she said she wants to look sexier,
Yeah.
more feminized,
Yeah.
and more attractive. And I said to her, why not, indeed. So let's have a look at Sarah's face before we start. Now, let's look at the front facial view, if we could get a close-up, please, with my expert photographer. And we can see a very balanced face, beautifully proportioned, actually, beautiful bone structure, lovely high cheekbones, pretty symmetrical, in fact, and that's always an advantage. But we can clearly see that the lips do lack fullness. All right, so I do agree with Sarah that that's probably one of the Achilles, or maybe the only Achilles heel on her face. So by promoting some mild projection and fullness to both upper and lower, I think we'll be able to address her concerns and give rise to a more feminized and more balanced, harmonious face. Now, let's look at the profile view. So Sarah, could I ask you to turn to the side? That's a great profile shot. And again, you can see a very balanced profile. Now, if you just come out, I want to see the full face. Full face. Just come closer in, a little bit closer. Come in for me, stopped right there, that's wonderful. Now, I would describe this as a class 1 profile, skeletally. You can see she's very balanced with a mid-face and lower face, her menton and pagonian projection, both in an anterior and inferior position, is very, very nice indeed. I don't think that warrants any further treatment. Certainly any further treatment would possibly masculinize her face, which we don't want to do. But we will keep an eye on that because, of course, when we project upper and lower lips, then we change the dynamics, and therefore we do need to keep a handle on that lower face and decide whether or not the chin requires any mild rectification. All right, so we're going to start by treating the upper lip, but before I do, I'd like to mark up some vital areas. So what I like to do is have a gauge of the center line of the patient's face, and I use 3 points of reference, and that's between the canthi and the symphysis, and I'll also use the base of the columella. And I like to draw, whether or not we're treating the filtral columns, I like to treat the mark out the filtral columns as a reference. Certainly in Sarah's case, because they're quite well defined, I doubt whether or not we're going to need to do that. Now, we're slightly off center, as you can see, so let me just mark that up again, if you may. Can I just wipe, please? Thank you. It's always useful to get this bit right, and I would recommend that you do all your marking up from the front of the patient, because that way you have a very good idea. Sorry if I'm blocking the camera. You can actually see that her philtrum lies slightly to the right, if you look carefully, ever so slightly, and hence why my drawings were slightly off. So I'm going to draw where I feel the philtrum ought to lie. to the top of the Cupid bow, to the base of the columella. You'll also note, which is quite useful, if we get a close-up of the lips themselves, just go straight into the lips for me, please. Close up. And a little bit more. You can see very clearly that the right-hand side of her upper lip, this section here, is smaller, okay, than the left. And that will need to be resolved if we want to achieve a more harmonious result. A rectification of any asymmetries would be beneficial. So I'm going to start with the right-hand side to try and promote some fullness, to try and match the left-hand side, and then we can take it from there. So if you'd like to pop yourself back. Right, wonderful. And I'll have that, please. Okay, you can pop yourself back now. Just put your head back. Comfortable there, Sarah? Wonderful patient. Okay. Okay, so we're going to start by placement of my entry needle, 5 millimeters short of the oral commissure, just into the mucosa. Okay, thank you very much. Right, if you'd like to just have a gauze ready, just one for yourself. We can put one there. You can come in. Okay, if you could take this out for me. Wonderful, thank you. So we're going to go in to the red lip itself. Little sharp there. She's only had very minimal cream, okay? I've elected not to give her too much anesthesia because, of course, that will promote fullness in itself and will give you an artificial situation. Now, placement of the cannula is very important. Positioning. In this case, we want to promote fullness in the red lip. All right, so I'm going to go in halfway between the vermilion border and the wet and dry mucosa and place my cannula very carefully in position, and I'm going to place some product very slowly. Well done. You may feel a little discomfort. That's lovely. Excellent patient. Okay, that's very good. And we'll just place a little bit just into the deficit there. And that way. You'll notice I'm short of the oral commissure deliberately because, of course, we want to avoid overfilling the corners. All right? And that's now the right-hand side treated with not much product at all, less than 0.2 of a mil, just to give you an idea of how much product we've used. And you'll note that we are pretty symmetrical to the right-hand side, and then you can actually see that there. Now, we have the option to skip to the other side, or we can complete the right-hand side of the lower lip. It really doesn't matter. I'm not precious either way, but why don't we skip to the right-hand side? Okay, how are we doing? All right? Open wide. And we'll just put a little tiny entry needle there. Thank you very much. We might need that needle again because we've done such a good job. Oh, we're okay. And again, very carefully, very light pressure. And again, placement is crucial. And we're going to go right to the columella. Don't cross this border. Avoid this tubercle area because, of course, in this area it will only give rise to the old-fashioned Paris lip, which we want to avoid, which seems very fitting. Good. Excellent. And I deliberately underplaced in this area because, of course, we were already fuller on the the left-hand side, sorry. Now, we should be there or thereabouts, fairly symmetrical with her lips, but we can certainly adjust this if necessary later. That's not a problem. Okay, now we're going to move to the lower lip. How are we doing, all right?
Yeah.
Great patient, must say. Great patient. Okay. Have a pencil a second, please. Just see that. Okay, that's fine. And again, open for me. Just relax. A little sharp. Okay. Thank you. If you could be so kind. And again, we're going to go into above the muscle. You can see that very clearly. We're above the muscle deliberately. We're channeling to just above the muscle. And I'm going to be slightly short of the midline because I want to create a slightly twin-lobed appearance. Open for me. Open. Open your mouth. That's it. Okay, good. And then we're going to go to the other side and do exactly the same. So all at this stage I'm doing is filling halfway in the red lip. So I'm being very precise with where I'm placing my cannula and therefore the product. Yep. Again, light pressure, very light pressure. See how easy that cannula stops short of the midline and then readjust, making sure we know where the bevel is. Good. Excellent. What a wonderful patient. Can I just wipe a second? Keep breathing, deep breaths. Very good. There's another one there. Right, I'll just take that for me. Right. Okay, let me have a look from the front. Good. Now, what we'll do, we'll actually have a look while, let me just check to see before we, just make sure the product is even, which it is. It looks very, very even indeed. Good, nice. Okay, we'll just sit the patient up now, and we can have a look at the camera. Just look straight ahead of you. Don't look at the photograph, just look at the camera. And then I'm going to look from the front to see if we've got just unconnect. Sometimes they become dry, so they stick. Bite together, that's fine. So put your lips together gently. That's it. And look at the camera, just to check for symmetry. I think we're pretty symmetrical there. That's nice. That's nice indeed. And also, we can see from the side profile, which is really where the magical view is going to be. So same again, as you did before. Now you will see a beautiful arrangement of that nasolabial angle with reference to her lower face. And you can see beautifully where the contour of this nasolabial angle has now changed. So we've got some projection here, but mild, taking into account what the patient wants. And look at the balance with the lower lip and, of course, the menton and pogonian. We can see it very nicely here with reference to the tip of the nose. They're pretty much in a straight line, which is a nice reference point to use. So I've deliberately not over-treated. Just to give you an idea of total amount used, well under 1 ml of product. We've used just over 0.6 of a ml total for this case, just to give you an idea of the amount. So we've by no means used too much. And I've done that deliberately because of the fact that you were very concerned about over-treatment. What I would recommend at this stage, what I would normally do is get you to have a look at it and then see what you think. If you feel that you would want more at this stage, we're more than happy to put more in. Or we can leave it a few weeks, 2-3 weeks, then go back in if necessary.
Okay.
So that's a nice conservative way of managing your expectations, not over-treating. And you know, so you don't give anyone a shock. And let's have a look. Do we have a mirror? We have a mirror somewhere? Okay. This is the moment of truth. Da-da-da-dum. Da-da-dum. There you go. Have a look. Now, do you feel they're big enough?
Yes. For that moment, yes.
Yeah. So that's important, isn't it? It's not about anyone else but the patient. The patient has to accept. Now, if you ask my opinion, you absolutely can go slightly fuller. There's no question because of the shape of your face and proportions. But I think it's absolutely right to take your view at this moment in time because it's the first time you're ever having this treatment. And I don't think it's wise to do too much too soon. Remember, you are going to get some swelling, which will last maybe 2-3 days, which is normal with any hyaluronic acid. Okay? I find that with this filler, it tends not to actually, with the Filorga Lips product, it doesn't actually swell up too much at all. And also, the use of my cannula technique and being very atraumatic means that we really would not expect too much swelling. Okay? And then reevaluate in a couple of weeks' time, 2 weeks' time, and then we can always add more. Okay? So I think we have a nice balance there. And let me just have a look. Bite together for me. Yeah. And you can also see the lower lip, which is very important, is ever so slightly larger than the upper lip, which is important, ever so slightly. In a woman, it's always nice, up to a golden proportion of 1 to 1.16, all right? Always should be slightly bigger. But of course, as I've said before, we can, next time round, we can bring this further down if we need to. But if I did it today, maybe it would have been too much for you. So what we've seen here today with a wonderful patient, Sarah, is not only atraumatic management, but also conservative management for a first-time patient who doesn't really know what they want. They certainly don't want to be over-treated, okay? And we have the ability, okay? We have the ability to go back in later on, quite happily, and repeat this procedure. Patient understands and knows what to expect. The material will mold beautifully, as we know, as we've seen and we've discussed, we've seen many times. The material is quite unique in that way, that the moldability of this product is really quite special and unique. And the fact that we're using this particular type of material and the fact that we have the ability to go back in again means that we can then bring that patient back and get the expectations met for the patient every time. And this is how to build your clinic and make it more successful every single time, by managing the patient, building that rapport, and not over-treating and making them look like monsters. It's all about delicate treatment and then building them up slowly. Thank you very much, ladies and gentlemen.